Well, the last couple of years have been incredibly busy. I have said more than once it's been like drinking from a fire hose doing policy work in Washington, D.C. the last couple of years. But there was, despite the fact that there was a lot of work going on to implement the Affordable Care Act, there was a great deal of interest, of course, in the Supreme Court decision and concern about what the ruling would mean. So when the ruling was released, there certainly was a great sense of a big exhale from the health policy community, and looking forward to how we can continue the work on the implementation of the Affordable Care Act. The ANA has had a long history of advocacy on healthcare reform, and the ANA's healthcare reform agenda is built on the belief that quality, affordable healthcare is not a privilege, but it's a basic human right. And much of the ANA's advocacy, and I believe the advocacy of many nurses who've been involved in this, has been around the provision of healthcare as a basic human right. So the ANA joined with 5 other healthcare groups in filing an amicus brief before the Supreme Court in support of the Affordable Care Act's minimum coverage provision. And I wanted to read a sentence from that I think really highlights the important role of nursing in the debate about healthcare reform. What ANA said was that registered nurses are frontline witnesses of the harmful health effects on individuals who are uninsured and defer needed care, and have a unique perspective to guide the court regarding the consequences of removing this provision. So I think that statement really summarizes my appeal to nurses to really take advantage of this opportunity of a national debate about healthcare reform and bring that frontline view of what it's like to provide care to people and the problems that we have related to the lack of access to basic healthcare services. Well, your question reflects, I think, the most important aspect of our policy and advocacy work at ANA, and that is trying to harness the tremendous potential power of the largest single group of healthcare professionals in the United States. Very often in our work, when we're engaged in advocacy and policy work, we remind the audience, we remind the policymakers we're attempting to influence, that we do indeed represent the largest single group of healthcare professionals. And nurses are very much the glue that holds the healthcare system together. We also have the good fortune of being the most trusted profession, according to the Gallup poll. So our concern at ANA and my interest in teaching the health policy course here at Yale is how can we inspire nurses to use that potential power we have as a profession. And I think our challenge as people who do policy work day to day is how can we draw the line for nurses between a provision in the Affordable Care Act or a regulation that's implementing it and the work that they do every day at the bedside, in the clinic, out in the community, wherever it is that they're caring for patients. Because there is a very important link between policy and advocacy work and their ability to care for patients. And my passion is how do we learn to communicate that to nurses and inspire nurses to get involved in policy and advocacy work. Well, one of the really exciting things about the national discussion about healthcare reform and many of the provisions in the Affordable Care Act is that they're aimed at trying to move our system from a sickness, illness-based system that pays for procedures more toward a system that is focused on primary and preventive care. And there are many components of the Affordable Care Act that are helping us move in that direction, payment for primary and preventive care services. And that's something that the public has been very responsive to and very interested in. Well, who does that best? Nurses. It's in our DNA to think about holistic care, about primary care, about preventive care. So your question, you asked about advanced practice nurses, but I think that there's a role for every nurse because of our training, what we bring to healthcare as nurses, that's different sometimes from other healthcare providers. But to your question about advanced practice nurses, we certainly learned the lesson in Massachusetts that simply providing people an insurance card and the ability to access care doesn't mean that they get care, because we know that we have already a tremendous shortage of primary care providers. So if we add 30, 40 million more people to the rolls of the uninsured, a very difficult problem is going to be worse. So that hasn't been lost on many policymakers, and because of that, there's a huge amount of attention being paid particularly to nurse practitioners as primary care providers. I'm a nurse midwife, so I also often remind policymakers that nurse midwives are also primary care providers for women. So one of the great things about the discussion in the last couple of years is that many policymakers who weren't very familiar with advanced practice nurses and maybe didn't really know much about what nurse practitioners or nurse midwives or even CRNAs or clinical nurse specialists do, they've really become aware of the role that APRNs can play in a reformed healthcare system, and also the role that nurses can play more broadly. Several things. I think I don't know how long this will live on the web and how long people will listen to it, but I think particularly right now, I'm thinking about the election coming up, but I think for the next couple of years, there's going to be a discussion about healthcare reform in this country like we haven't had in my professional lifetime. And I think my message to nurses, and particularly to the best and the brightest of the Yale nurses, is to take advantage of this opportunity. There's a national debate and discussion going on about healthcare reform, and nurses have such an important role to play. The voice of nursing is absolutely critical. Every nurse, no matter what he or she does, whether it's a PNP providing primary care to children, or a clinical nurse specialist in a hospital, or a midwife in a birth center, no matter what our specialty is, where we work, what kind of setting we're in, we bring the voice of patients, very often underserved patients, to the debate about healthcare in a way that is really important for policymakers to hear.